I'm Dr. Abdul Rehman, your course instructor for the subject Human Physiology, having a course code MLT-111. Today I'm going to record part C of lecture second, that is cardiovascular system. Lecture outlines. Today we will discuss the blood pressure, which is the pressure exerted by blood over the wall of the vessels during its transport. It is one of the principal parameters which is used to determine the healthy state of our body, because normal blood pressure is vital to life, and without the pressure that forces our blood to flow around the circulatory system, no oxygen or nutrients would be delivered through our arteries to the tissues and organs. That's why it is an important parameter. After this, we will discuss the electrocardiography, which is a technique used to determine the normal state of the heart. And during ECG, different peaks were observed. So these peaks are important parameters because their positions and their intervals indicates us the normal state of the heart. And if there is a variation in the peak position or their intervals, then it reflects that the heart has been infected with some infection or some disease. Five different types of peaks were generated during ECGs, and these includes polarization and depolarization peaks like P, Q, R, S, and T. These are the different peaks. At the end, we will discuss the ECG abnormalities, which gave us the position of the peaks and also their intervals. Let's start our today lecture. Blood pressure. As discussed earlier, blood pressure is the pressure exerted by blood on the walls of the blood vessels when it passes through it. Or in other words, blood pressure is the force that moves blood through our circulatory system. It is one of the important factors because oxygen and nutrients would not be pushed around our circulatory system to nourish tissues and organs without blood pressure. Blood pressure is also vital because it delivers white blood cells and antibodies for immunity and hormones such as insulin for normal body growth. Just as important as providing oxygen and nutrients to the body, the fresh blood that gets delivered is able to pick up the toxic waste, including carbon dioxide, which we exhale with every breath, and the toxins we clear through our liver and kidney. Therefore, blood itself carries a number of other properties, including its temperature. It also carries one of our defense against tissue damage, that is, the clotting platelets that prevent blood loss following injury. But what exactly is that? Blood to exert a pressure in our arteries. Part of the answer is simple. The heart creates blood pressure by forcing out blood when it contracts with every heartbeat. So blood pressure, however, cannot be created solely by the pumping of the heart. What is the basic function of the blood pressure? Our circulation system is similar to a highly sophisticated form of plumbing. That is, blood has a flow and arteries are pipes. A basic law of physics gave rise to our blood flow, and this law also applies in a garden hose pipe. Blood flow through our body because of a difference in pressure. And there are three different pressures like systolic pressure, which is the maximum pressure during heart contraction, and the normal value is 120 millimeter Hg. Another is the diastolic pressure, which is the minimum pressure exerted by blood over the wall of the vessels during resting stage, and the normal value is 80 millimeter of Hg. And there is a mean arterial pressure that that is the average pressure tending to push blood through the systemic circulation, and its value lies near to the diastolic pressure, that is 96 millimeter of Hg, but often it has been taken as 100 mg. Our blood pressure is highest at the start of its journey from our heart, that is when it enters the aorta, and the blood pressure is lowest at the end of its journey along progressively smaller branches of the arteries. That pressure difference is what causes blood to flow around our bodies. Arteries affect blood pressure in a similar way to the physical properties of a garden hose pipe affecting water pressure. So the constructing the pipe increase pressure at the point of construction. Without the elastic nature of the artery walls, for example, the pressure of the blood would fall away more quickly as it is pumped from the heart. So while the heart creates the maximum pressure, the properties of the arteries are just as important to maintaining it and allowing blood to flow throughout the body. The condition of the arteries also affect blood pressure and flow. That is, narrowing of the arteries can eventually block the supply altogether, leading to dangerous conditions including stroke and heart attack. There are different categories of the blood, like in normal state, the diastolic pressure lies in the range of 120, while diastolic pressure is in less than 80 millimeter of Hg. A slight elevation indicated that the systolic pressure raised to 120 to 129, while in diastolic it should be in the less than 80 millimeter of Hg. Stage 1 high blood pressure, where the systolic blood pressure raised to 130 to 139, and diastolic pressure is in the range of 80 to 89. These three are the normal condition of the blood pressure, but stage 2 and stage 3, these are the critical stages, and during these stages the blood pressure increases. Like you can see, the systolic pressure raised to 140 or higher, while the diastolic pressure is raised to 90 or higher. While in hypertensive crisis, it is in the range of 180. That is the shock stage. During this condition, the patient has more chances to move into the coma condition and automatically leads towards the death. The next is electrocardiography, also termed as ECG. Electrocardiography is a test that has been used to measure the electrical activity of the heart. With each heartbeat, an impulse or wave generated that travels down through the heart muscles. And these waves causes the heart muscle to become squeezed and pump blood to the circulatory system. A normal heartbeat on ECG will show the timing of the top and lower chamber of the heart. In other words, it is a transthoracic interpretation of electrical activity of heart over a period of time. And normally it has been detected by placing electrodes over the surface of the skin and then recorded by a device called electrocardiogram that gave us the status of the heart in graphical form, contain different peaks. Here you can see P, Q, R, S and T waves. The right and left atria or the upper chamber of the heart generate first wave or P called P wave, and then there is a flattened line. After this, electrical signals travel down to the lower portion of the heart, that is to the ventricle, where they generate another wave or P called QRS wave. The final wave or T wave represent electrical recovery or a return to a resting state for the ventricles. So why electrocardiography has been used? It is used to detect different heart states like heart rate, heart rate, site of pacemaker present in the heart, site and type of heart diseases, and effect of electrolytes and drugs. Normally, ECG gives us two kind of information. First, by measuring time interval on the ECG, a doctor can determine how long the electrical waves takes to pass through the heart, and by finding how long a wave takes to travel from one part of the heart to the next shows if the electrical activity is normal or slow, fast, or irregular. So it gives us a clear picture of the heart. Second, by measuring the amount of electrical activity passing through the heart muscles, a cardiologist may be able to find out if parts of the heart are too large or overworked. Now there are two questions that does it hurt? No. The answer is simple no. There is no pain or risk associated with having an electrocardiogram. When the ECG strikers are removed, there may be some minor discomfort, but the second question is it harmful? Again, the answer is simple no. The machine only records the ECG. It does not send electricity into the body, so it is not harmful. There are two basic components of ECG. First one is ECG waves, and the second one is intervals among and ECG waves. So we will discuss both these components in detail. First, ECG waves. There are three basic waves: P wave, QRS complex, and T wave. The first two waves are depolarization waves. What does it mean? It means that in case of P wave, the arteria, that is the upper portion of the heart, are in contraction, while QRS complex indicates that the lower portion of the heart, that is ventricle, are in contraction. While T wave, these are the repolarization wave, indicates that the ventricle become in a resting stage. So we will discuss these different waves in detail. P wave, it is actually caused by potentials or electrical signals generated by arterial contraction, and it represents that the impulses travel down through the sinoarterial node over the artery. And what are the significance of the P waves? It gives us indication that sinoarterial node is actually a pacemaker present within the heart. Second, impulses travel down in a normal direction, that is from artery towards the ventricle. So whenever the P wave, inverted P wave observed, then it means that electrical signals generated from ventricle towards the artery, that is one of the disease. So normal P value gave us that the impulses travel down in a normal direction. And the third one is voltage of P waves indicate mass of arterial mass. If there is enlargement of the upper portion of the heart, then more voltage will be required by P waves, which indicates there is a problem in the heart. The second wave is QRS waves. It is actually a potential or electrical signal generated by ventricular contraction. And what it represents actually three waves: Q, R, and S. Q wave is a short deflection wave that indicates that the ventricle just only start contraction, and after this there is a large upward deflections called R wave. It means that here in this case the ventricles are in their peak level of contraction, and S waves, that is the sharp downward deflections, here indicates that the ventricles moves towards the resting stage. And what are the significance of the QRS waves? It gave us about the ventricle mass, strength of the contraction, and duration of contraction. The last and third wave is T wave. It is a repolarization wave and generated by electrical potentials of the ventricular resting stage. And what are the significance of the T waves? It gave us indication about the heart diseases, like if there is an inverted T peak, it means there is ischemic heart diseases. The second component of ECG is interval among different peaks generated during ECG, and the first interval is PR-RPQ interval. It is the duration between generation of the P waves and generation of QRS waves. It actually represents the intervals between contraction of the upper portion of the heart, that is atrium, and beginning of the lower portion of the heart, that is called as ventricular. And normal time required for PR-RPQ interval is 0.35 seconds. The second interval among the ECG peaks are QT interval. It is the duration from beginning of QRS complex to the end of the T wave. And prolonged QT intervals is a risk factor because for ventricular tachyarrhythmias and it will lead towards the sudden death. The normal duration for QT interval is 0.48 seconds approximately. So what will be the total duration of one ECG? The total duration of one ECG is the time required from one heartbeat to another, and it is equivalent to 0.8 seconds approximately. Electrocardiography abnormalities. Abnormalities mostly observed in the peak positions and intervals among the peaks, like in P wave abnormalities. So we will observe inverted P waves, which indicates that the sinoarterial node, which acts as a pacemaker, shift from SA node to AV node, while absent of P waves indicate that there is no arterial contraction. So this has been mostly observed in arterial fibrillation. The third abnormality is P pulmonale, where we observe tall and peak P waves in the right arterial hypertrophy. Whenever the size or mass of the atrium become enlarged, then such type of tall and peak P values were observed. The next abnormality is observed in QRS waves, like prolonged QRS complex. It means that the ventricle muscle become enlarged and it takes more time to become contracted. So caused by hypertrophy or dilation of left or right ventricle. Then another abnormality is high voltage QRS. Again, high voltage represent that there is a hypertrophy in the ventricle position. So that's why they take more voltage. And then there is irregular bizarre type QRS complex, which is caused by destruction of cardiac tissues and its replacement by scar tissues. In T-wave abnormalities, we will observe that inverted T-wave, which indicates ischemic heart diseases, that is myocardial infarction or cardiac arrest. And sometimes tall T-waves were observed when the concentration of potassium ion becomes high in the cardiac muscles. This is the end of our today lecture. Thank you so much.